or something else, mental health wise.
Absolutely, absolutely. And well, there's lots of stuff going on actually. But it seems as if, and please correct me if I'm wrong, it's not as deadly as the other variants. What do you think?
Well, I think that's what.
Right?
So it's still early days, though, Poker. We don't really know. Omicron, we only found it about it around the 23rd, 24th of November. So it's still early days, I would say, in terms of, knowing about Omicron. So I don't think we know enough, but I think there's enough concern around it. I think, yes, rightly so. We are not, it's not actually as deadly as the COVID-19, the SARS-CoV-2 variant. But it's still a variant of concern where people are concerned about getting the Omicron. They're concerned about the spread, as you said. So I think these are the main things that obviously everyone's worried about.
All right. Okay. Now let's go to our schools. And at the beginning of the show, I just did a little intro about the fact that Nadim Zahawi is saying the secondary schools in England will wear masks in classrooms, not for a day longer than necessary. Yeah. The education secretary defended the requirement to wear masks during lessons as Omicron cases surge. Yeah. He also added, ministers are determined to keep schools open after learning a painful lesson from earlier closures. What would that mean, Dr. Seshning?
So, yes, I think what they're saying is that everyone should be wearing masks, isn't it? That's the understanding that I got. I think there's a lot of controversy around that because some people feel that they shouldn't be wearing masks. To be honest, I personally do feel that, and I would voice that opinion that everyone should be wearing masks. So I'm not sure what your understanding or your opinion is, but I think that students and teachers should be wearing masks. It's important. Children are, even though they get a really mild form of the illness, and lots of them are asymptomatic and then test positive, there's still a chance that obviously they are the ones that are spreading it to the more vulnerable population. So they're spreading it to teachers, to other older people, to their relatives, the grannies and grandfathers, so I think that's a concern.
Yeah. Well, there's a school of thought. There's a school of thought that it's not very practical for students or for school pupils to wear masks in the classroom. Yeah. Because obviously the teachers would want to see their reaction, the facial reactions, and that's all part of the teaching process and the learning process and all that. I mean, there's all sorts of schools of thoughts about students wearing masks, but I personally think that the ministers and the government would have thought that through before coming out and saying that students should wear masks and all that. Are there any more? Let's move away from the classroom now. Let's come to life on the streets and in homes. Are there any more restrictions? That you know about?
No. So the main thing that everyone's talking about still is about the masks. So wearing masks in school, the teachers and pupils. I think that's what the main restrictions at the moment and the concerns. But personally, as I said, I think when the government decided that people should not wear masks and it was no longer compulsory, remember Freedom Day that we had, So a few months ago. So I think even when that happened, I think that was a concern. So I think obviously that has possibly contributed. And I mean, from the outset, we've been given strict guidance from WHO, POCO, from Dr. Tedros and his team was that, wearing a mask, hand sanitizing, maintaining social distancing, and obviously isolating if you've got symptoms. And now getting the vaccines, the dose one, the dose two, and the boosters. I think these are the only things that is going to help. And so wearing mask is one of them. Personally, I've always been wearing a mask. I don't go anywhere without a mask on unless I'm eating or drinking. But otherwise, it'll be always wearing a mask in public places and outside. So I think it's probably going to, what we're seeing, what's happening in schools, they're probably going to be looking at something similar. We know that on railways and any form of transport, people are made to wear masks. So it's compulsory. If you go in the undergrounds in London or any of the transport, they do say wearing a mask is compulsory and people need to wear masks. So that is a must. Obviously, open public places, people need to wear masks.
Yeah, I was watching the Arsenal game the other day on telly, and I didn't see anybody wearing masks at the stadium. There weren't that many people wearing masks at all. It was just free for all. Yeah. Screaming and shouting and all that. Of course, I do understand that you would have to have a negative test before you are allowed into the stadium, which I do understand. But when I was watching the game, I was thinking, oh God, not many people are wearing masks at all. I mean, and it's going to be a huge super spread. If one person has got it. That's what I was thinking. Fortunately or unfortunately, we haven't heard anything at all about that. I haven't heard anything about, a spread from the stadium or from, large gatherings and all that. So hopefully things are getting, things will get better. Now, the other thing I wanted us to talk about is it seems as if, no, actually, it's not. It doesn't seem. It's the truth that we're having more jabs. A lot more people are jabbing. Got boosters and millions of people are jabbing. But the what you call it, the virus is still spreading. There's a lot of infection around. Why?
The numbers are still going up. We're still getting like in the 180,000
why?
cases and up to 332 cases of people dying. So the numbers are spreading. We've just finished with, we're still in the festive season. We've only just come out of it, only just, because we still on the bank holiday. So we've just had Christmas, we've had New Year. Before that, we've had all the Christmas parties. So everyone has been really relaxed. People have been socializing and just being, in the spirit of the, the Christmas and festive season. So it's understandable that a lot of people have been socializing and traveling and just making the most of this time that they may have off from work or spending time with their family and loved ones or friends or partners or spouses. So it's understandable that everyone's been mixing. So there's been a lot of socializing, a lot of people gathering for meals and parties and celebrations and drinking as well. So lots of partying. So understandably so, as social beings, we've made the most of Christmas, and possibly this is going to be one of the things that's going to obviously contribute or has contributed to the numbers that we are seeing.
Okay, so with all this going on, what is the mental health effect on us as a people?
So I think that's such a good question, Apoko, because
I had to make it very general so that you can go run with it and tell us, you're an expert on that. So yes, we would want to hear.
I think, thank you, Apoko. That's such an important, interesting question, especially for 2022. We have been broadcasting on COVID-19 since February 22nd, 2021. So we've
2020.
Oh, 20. Oh, yes. Sorry, 2020. Oh, my goodness. Yes. So 2020.
We're going to be celebrating 2 years in a month's time.
Yeah. So I think people are exhausted. Um, it's it's been a long journey. We found out about COVID in December 2019. It came from Wuhan, China. And when that started, the rest of the world started to learn and see and live with COVID 19. So, if you think about it, the time that has elapsed from December 2019 until January 2022, people are exhausted. We are basically just living this life in COVID, and I think people have come to a point where they feel like maybe their energy is depleted, their motivation is depleted. And I think what 2022, how to cope with all of this, is to try and understand that we have gone through the pandemic. We've gone through maybe the first, second, third. Some countries are talking about the fourth and the fifth wave. So we've gone through the different waves of the COVID pandemic. A lot of us have survived. Yes, over 5 million people have passed away due to COVID and other causes. So a lot of us have lost loved ones, but we have managed through it. So that's the first thing. The second thing is that we are all in it together. So we're not alone. So it's a cathartic type of feeling where we know and we're reassured that we're not going through this alone. You know, we have each other to draw upon, and people are a lot more because we've gone through COVID. People have changed, people have paused, they've set the reset button, they're much kinder, they're more helpful, people are more loving, they're showing more compassion and empathy for others because of what we've gone through. And I think the third thing is to understand that we do have treatments available. We do have the knowledge and the awareness and the understanding, the education around COVID-19, and we just need to adhere to the guidance that we are getting. And then the fourth thing is understanding that we need to continue to live with this guidance, and that we need to have that hope that things are going to get better and that there will be light at the end of this tunnel, that eventually it will all end. But I don't foresee it happening in this next year. I think we are still going to be living with COVID. And I mean, the first thing is we will go down in history as a generation that has lived through COVID, and our children, our relatives, everyone that's gone through it. So I think it's going to make us, it has made us stronger, it's made us better people. And to be honest, as much as it's a difficult period and people are tired and exhausted, and a lot of people are going through challenges, maybe financial, relationship, jobs, health issues, you know, people are going through these difficulties through mental health problems or exacerbation of underlying mental health problems. I do believe that we will overcome it, because we've shown that from the onset of COVID-19, we have been able to. So I'm very hopeful. I'm very optimistic, and I'm cheering on for 2022. And I'm wishing that everyone is going to have a better and a more positive 2022, filled with joy, happiness, love, prosperity, good health, and that everyone stays safe.
Interesting. And are there any cases in mental health hospitals that are as a result, directly or indirectly, of COVID-19, would you say?
They are. So there is a lot of cases, and personally, I've heard from people that have actually tested positive and gone to hospitals, or they've gone to hospitals awaiting testing. And when they've tested positive, they've had to go into COVID wards. I don't think we're getting accurate figures in the media in terms of hospitalizations, and there is a concern. I've personally spoken to people during this December period and more recently, where people have been waiting to go into hospitals. So two things. One is people going into hospitals for other conditions apart from COVID-19. So people have been waiting for beds up to 3 to 4 weeks to get treatment, inpatient hospital treatment. So this means that if someone obviously cannot be treated by their GP and by community treatment, you know, for any physical or mental health problems, people have been waiting for beds. The second thing is people have been waiting for beds and then have gone in and then they've tested positive, or they've gone in with symptoms and then tested positive. So the third thing. So there is a lot of hospitalizations. If the numbers continue to increase, that's why that's such an important question you've just asked. And I'm not sure why you asked it, but there is a concern that the bed situation is going to become a crisis, and it will be a crisis nationwide throughout the UK. And we might see it in Scotland and Wales as well.
Yeah. What about in mental health hospitals? Yes. Like, you know, mental homes and mental asylums and all that. Do you have any statistics on the spread or otherwise in these hospitals, and what are the main effects this is having on patients in mental health hospital?
Yes. So there isn't any figures as such, Apoku, because I think what the figures we're getting is just general figures of people hospitalized with COVID-19. We do know, and I personally know, that there are cases in hospitals where people are testing positive, and in mental health wards and mental health care homes and institutions. So people are testing positive. It is impacting because obviously not only do people then have a mental health issue, but then there's a physical health issue as well, where we need to follow strict COVID guidance and policies, which obviously everyone is adhering to. So it is obviously something which is more challenging and complex, but I wouldn't say it's much more different than just general COVID wards. So I think it's just about managing the patients that are obviously testing positive, ensuring that everyone's getting tested, people are isolating, people are getting treatment, their oxygen and vitals are being monitored, and people are receiving the appropriate treatment. So I think it's exactly what the management would be on the medical wards would be the same in mental health wards and institutions. We don't have figures, as I said, but I think there is an increasing amount of those numbers as such. I think we are seeing more and more, as we obviously seen with the rise in the Omicron since November 2021.
Right. Okay. Let's quickly talk about the air travel industry vis-a-vis COVID-19, and then we will go and then we will do the numbers. I research and ask people, and it's true that the Emirates airline, for example, you know, the Dubai.
Yes.
They've and that includes Ghana. So there's no flights in and out of Ghana with Emirates. And it's not just Ghana, but there's some other countries. So I was trying to pull it up. Give me 1 second. Let me see if I can pull that up. So Emirates suspend flights. Give me 1 second. Right. I don't know if you've heard about. Have you heard that story yet?
Yes, I have an understanding. Yes, but if you go on, Opoku, then we can discuss.
Well, I'm just reading it here. It says Emirates Airline on Tuesday, that's some days past, that was in December, suspended indefinitely the entry of travelers from 10 African countries, including Ghana. The airline said passengers on direct and transit flights from Ghana, Angola, Guinea, Kenya, Tanzania, Uganda, Cote d'Ivoire, Ethiopia, Zambia, and Zimbabwe will not be permitted to travel to Dubai from the 28th of December 2021. And the first question I ask myself, and I ask anybody and everybody, is why would you suspend flights from these African countries when we all know, the whole world knows, that Africa has the least amount of cases? Why? Is it just economic? Is it political? What is it?
I would ask the same question. I'm just as puzzled.
I know you're stunned. You're just thinking the same, aren't you?
Exactly.
I don't get it. I just cannot get it.
I don't understand it, and I think it is.
Can't get it at all, because this is the continent that has the least number of infections. And to be fair to Africa, I believe that Africa is managing the situation way better than most continents.
Africa has managed extremely well.
Absolutely, yeah. So why?
It is a concern. So obviously, it seems that different countries are obviously looking at different approaches, different guidance that they're using, and different numbers, because obviously we know Ghana is like way down on the list, in the hundreds on the worldometer, no way compared to UK number 4. So, and USA, India, and other places. So it is obviously questionable why some countries have obviously taken such a serious and drastic measure to say that these countries are now restricted for travel. And I can understand your frustration as well, Abogu, because Ghana has done extremely well. Most of these African countries, I don't think we can say any one of them have been countries that we've been concerned about at all during the pandemic.
No,
I've never
not
heard
at all.
of any of them.
Not at all.
So it is obvious.
Not even South Africa. South Africa is probably got the highest number of cases in Africa. But compared to the other countries in the world, South Africa, they are way better, way better at controlling and managing the situation. So it just, I don't know. It in some way somehow annoys me when I see this thing. It's not because I'm African, but it's because I think it's not fair on the countries that have the least number of cases and the countries that have better managed this situation than all the big countries, than all these so-called developed countries and all that. And but some way, somehow, these are the countries that are being victimized, because it will affect the economy, it will affect the tourism industry, and it will make them poorer. So it's just not fair. That's what I think. And probably this is not the platform to say these things, but I'm going to have to say it.
Yeah, no, I do understand, and I agree with you. It is not fair to understand, what are the guidance, what are the criteria. I would like to know what are the guidance, what is the criteria they're using to make these decisions. Secondly, we know the only thing I can add to this, Apoka, is we know that with travel, we have seen, because people have traveled from different countries. This is when we saw that there was a rise in numbers and the spread of COVID-19. So obviously it makes sense then that people needed to look at the travel industry and try and put restrictions. So we've got the green list, the amber, the red list. So we've had countries obviously reviewing their lists regularly, including England and South Africa and other African countries as well, like Ghana. And then the next thing is, I'm just trying to understand, where has this come from? So is it because of, looking at different countries and the geographical locations, and not considering the numbers, So maybe just because Ghana and the other African countries do not have high numbers, but because of their geographic, and maybe because of the traffic that goes from these African countries to Dubai and Emirates, whether this is the reason why they've done it. So there's so many things I think we need to obviously try and understand why they've made the decision. But I do agree with you, it does not seem fair in terms of making such a drastic decision to have these countries not be able to travel, because as you said, it is going to affect the economy of these countries, and also Dubai. It's going to affect also the tourism industry. So it's going to affect people's jobs, people's livelihood that depend on travel, and international travel, because a lot of people might be using these African countries as well as a stop before they go to another international destination, which I assume will be happening. So it is going to affect a lot of things. So, and then the next thing I do want to say is, obviously, a lot of other countries are going to probably adopt the same. So if we've seen this happening now with one country,
and then there's going to be that kind of tax approach to things, like Nigeria did to the UK, and I should spend on people. I have to spend your flights from your country as well, and where are we going to go with this? And then how far are we? How deep are we going to go with this? I suspend your flights from your country, and you suspend flights from a country, and I will not let your citizens enter my country because of COVID and this and that. Well, where will be the point where we say, okay, it's enough, let's get on with life? Because we whether we like it or not, COVID's come to stay. It's here. It's going to be here. We just need to manage it well. Help them, country to country, human being to human being, to overcome this horrible virus instead of victimizing. That's my opinion, and I think the leaders will have to sit down and think through this properly. And it's aviation industry. It's killing the tourism industry all around the world. It's not going to affect only just the African countries that have been suspended. Don't forget that all these huge countries, they make a lot of money from Africa as well, So it's going to affect them as well. It's going to affect everybody. And it's become a lose-lose situation. I think we need to step up. I'm being a politician now, and
I can, and I agree with you 100%.
I should be part of
it. Yes, you should. You should. No, it's good to have these healthy debates and healthy discussions, and obviously share our opinions, because the way you're feeling, Opoku, is you're not the only one. This is what I've said earlier. We are all in this together. There are so many other people, like-minded people from Africa or even not from Africa, that are listening and saying, I agree. Why have they made this decision? People are stunned. They puzzled, as we are frustrated that these decisions are being made. We have no idea how they've made these decisions. So yes, if we had that information, Opoku, then I think it would be easier. But we don't have that information. We don't know how they've made that decision. So I think that's where the difficulty lies. Had you known, okay, they've put these countries on the list and this is the reason why they've made that decision. They've got information that we don't know about. So I think if I had that information, then I'd be more reassured.
I would definitely understand it if they said these countries have very high numbers of COVID cases, Omicron, this and that. They've got very high numbers, and so we don't want, flights from these countries because there's a possibility of them spreading this thing. But these are the countries that have the lowest numbers. You see, that is what puzzles me. Anyway, let's move on before. Let's move on. Let's do the numbers now. We've only got a few minutes to go.
Yes. So in terms of the Worldometer, as of the 3rd of January 2022, the following figures. So we've had 290,705,241 positive cases globally. Total number of deaths are 5,461,875. Total recovered 254,647,983. So those are the global figures. The top 5 countries: USA number 1 with 56,142,175. Total number of deaths 847,408. That's really a lot of people in USA, I must say.
Yeah.
That's quite a large number. India number 2 with 34,922,882. With total number of deaths 481,893. Brazil number 3 with 22,293,228 positive cases, with 619,171. So Brazil is actually number 2 in terms of total number of deaths. So that's a very high number again. UK,
really high.
Very high. UK number 4 in the world with 13,235,401 positive cases with 148,851 deaths. Russia, number 5, with 10,554,309 positive cases and 311,353 deaths. So, and we'll go to Ghana, very, very low down.
Okay.
Number 107 in the world, they've done really well with 145,052 positive cases and 1,303 deaths. And if we look at the UK, the 24-hour figures, we are looking at, just get the figures for you. So the 137,583 new cases with 73 new deaths.
Mm-hmm.
So that's the UK 24-hour period. January 1st was 161,692 with 154 new deaths. So that was the figures that we've had. So every life matters, and the numbers are still increasing. The advice would be, according to the government and WHO guidance, is wear a mask as much as possible. Isolate yourself. If you experience any symptoms, use a hand sanitizer. Ensure that you are social distancing, and also, just ensure that you take the vaccine if you can. So do find out about the boosters and also the vaccines that are being rolled out. And if you feel that you need to take it according to the guidance provided by the government and WHO, then please do get the vaccination, because the only way we're going to be able to combat this and reduce and be able to see an end to COVID-19 is if we all adhere to the guidance. That's the only way.
Thank you very much, Dr. Seshni, for joining us this morning, as always. And have a fantastic day.
Have a fantastic day, Opoku. And yes, Happy New Year again to everyone. See you again soon. And just I wanted to say belated birthday to Arman Mutlia, which is my sister's son. His birthday yesterday. So we had a bit of an online celebration, which is the way forward. You rather, just see people online, which has been great in terms of the COVID-19. So happy birthday to him, and hope he had a wonderful birthday. And also Desmond Tutu passed away on the 26th of December. So Archbishop Tutu, so, we hope.
It did. Yeah. Amazing man. I met him.
I met him as well. Yes. Yeah. Oh, amazing.
Yeah.
Where did you meet him?
Amazing man, yeah. Very funny. Huge sense of humor he's got, or he had, I'll say. Anyway, thank you very much, Dr. Seshni, and we will see you sometime.
Hopefully again soon. Thank you so much, and have a fantastic day. Bye-bye.